Okay, now in continuation with the first video that is associated with Clostridium perfringens, now it is in continuation with that. First I will discuss about the stormy clot formation. So the stormy clot formation is associated with the lactose, or which we call as a milk sugar, which will undergo fermentation to produce acid and to produce gas. And the acid which is produced, it will basically degrade this milk protein, which will undergo coagulation to produce this clot, and you get to see this clot in this particular test tube. So that is basically stormy clot formation, because there is a stormy fermentation to produce acid and gas, which will bring about the clotting of the milk protein, right, or coagulation of the milk protein to produce clot. Now moving on to the toxins, in the last video also we have talked about few toxins, but actually Clostridium produces 12 distinct toxins, out of which the 4 major toxins are alpha, beta, epsilon and iota, where type A is basically associated with alpha toxin, type beta is alpha, beta and epsilon toxin, type C is alpha and beta toxin, whereas type D is alpha and epsilon toxin, and type E is basically alpha and iota toxin. So you understand that this only one organism produces 12 distinct toxin. It is not that much easy, and when a person is infected with this particular pathogen, elimination of that particular organism is also not that much easy from the individual. So that's why Clostridium perfringens is a very, very important organism of significance, and it has to be handled and taken care of, and properly interventions and treatment should be there for the recovery of the patient. Now moving on to this alpha toxin, that is the major toxin and most discussed toxin in your Clostridium perfringens, which is also called as phospholipidase or phospholipase, which is lecithinase C. It is basically lecithinase C, right? And it causes toxicemia or toxemia, that is the toxicity, right, in gas gangrene. Like if I say bacteremia, that means microorganism or bacteria in blood. If I say viremia, means virus in blood. So toxemia, when your tissue is infested with the toxins and the tissue starts to die. Now you understand that this is lecithinase C. So where do you found this lecithin? So that is a very, very important factor. That's why this toxin, this toxemia, is further again differentiated as lethal. Yes, it is lethal. Dermonecrotic, that means the dermal layer undergoes necrosis, that is your accidental cell death, induced cell death by this particular toxin, and slowly the cell starts to die. And also hemolytic, that is another important point. You see students, like if we have talked about pneumococcus, streptococcus, we have only talked about hemolysis, RBC lysis and all these things, but they are also pathogenic, but this single organism is both dermonecrotic, that is it is also causing necrosis as well as it is causing RBC hemolysis. So how much pathogenic it is, what is the effect on an individual, you understand yourself, right? So that's why this is dermolytic, lethal and hemolytic. Now it undergoes RBC hemolysis at 37 degrees centigrade, and when chilled to 4 degrees centigrade, what happens is that they basically split this lecithin, and when they split this lecithin, what will happen? It's an important component of your mammalian cell. So this mammalian cell, that is the plasma membrane of the mammalian cell, gets disrupted, and it can easily undergo the penetration of this particular toxin, which results in further degradation of the protein and killing of the microorganisms, though there are many minor toxins as well. So these are major toxins which I talked about. Now minor toxins are, this is the gamma toxin, eta toxin, delta toxin, even you have the theta toxin, lambda toxin, kappa toxin and mu toxin. So many different kinds of toxin basically comprises of this particular Clostridium perfringens. That's why this microorganism is very, very difficult to tackle. So with this I complete my video 2, or the section 2 of this Clostridium perfringens, though I will be dividing this section into many smaller sections for your understanding, right? So if I brief or conclude this, we have basically talked about the stormy clot formation, which I have talked about, where lactose is converted to acid and gas, and then the milk protein coagulation to produce clot. Then we moved on to 12 distinct toxin which is produced by this organism, out of which we have talked about 4 major toxin which is classified as A, B, C, D, E. Like A goes for lambda, B goes for lambda, beta, epsilon, C goes for alpha and beta, type D goes for alpha and epsilon, type E goes for alpha and iota toxin. Sorry, it is not lambda, it is alpha. Now we have also talked about the major toxin which is alpha toxin, which is basically a phospholipase or lecithinase which causes toxemia in gas gangrene, which is demonstrated by its lethality, its dermonecrotic property and hemolytic property. I have already discussed about what is dermonecrotic and what is hemolytic, and then it undergoes RBC hemolysis, which I have talked about at 37, and chilling to 4 degrees C. Lecithinase basically splits the lecithin and destabilizes the plasma membrane of the mammalian cell such that it can be killed, or even the penetration of toxin for protein disruption or protein degradation becomes easy because it is also proteolytic. The toxins are also saccharolytic. Next we have moved on to the minor toxins which are also there in this particular Clostridium perfringens, that is gamma, eta, delta, theta, lambda, kappa and nu, which we will be discussing in my next video. So of course Clostridium perfringens is a organism of great medical significance, and when a patient or when a individual has contacted this particular pathogen, it has a great care need to be taken with proper medication, with proper antibiotic, with proper diagnosis. Otherwise it results in amputation and sometimes even death of the patient. Thank you so much.